Some people fear that eliminating the private health insurance industry would be harmful to our economy. Our economy now suffers from some pretty harmful aspects of our broken health system. We're wasting $500 billion every year on non-productive administrative overhead. Doctors and hospitals hire rooms full of clerks just to argue with insurance company clerks. We pay the world's highest prices for prescription drugs because Medicare was banned from doing what every responsible free market business does: negotiate prices. Many employees are locked into their jobs just to have health insurance. And wages in many sectors are flat, largely due to rising health insurance costs. Hundreds of thousands of people go into bankruptcy every year, most due to medical debt. All of these aspects are getting worse, as are many of our health outcomes. Our present non-system is pretty well wrecking the economy and our national health by itself. You may be concerned that putting all of these insurance employees and the billing and insurance clerks in hospitals and doctors' offices out of work might be harmful to the economy. There are around 1.7 million people in these jobs. Many are doctors and nurses whose professional skills could be put to more productive use if they return to taking care of patients. With an expanded Medicare, more clerks would be needed than work for Medicare now, so many will move from working for private companies to Medicare. But what about the rest? Both of the Medicare for All bills now before Congress include funds for job training and transition, so any displaced workers will be taken care of. But let's look at them in the context of our huge national workforce. We have around 150 million people in full-time jobs. Every month, around 5 million people change jobs. And every month, around 1.7 million, the same total number as work in health insurance administration, are fired. They have no new job prospects, no provisions for retraining. Most draw unemployment, your tax dollars. If the administrative job loss is noticed at all, it will most likely be a tiny blip on the radar screen. And many people, no longer bound to their jobs by insurance, will start new businesses and hire more employees, stimulating the economy. Drug company profits would decrease as better prices are negotiated for all of us. But that means more money remaining in the hands of people who buy prescription drugs. That spending power would further boost the economy. People say that we shouldn't turn 1/6 of our economy, that $3.5 trillion that we spend on healthcare, over to the government because government can't run things as well as the private sector. But we've seen how not so well the private sector has done in healthcare. And we've seen how efficient the government is with Medicare. Maybe if we turn paying for healthcare over to the government, pretty soon healthcare will amount to just 1/7 or 1/8 or even 1/16 of our economy. That's what it is in Taiwan, where an American designed their single payer just over 20 years ago. We don't even need to look to another country to design a good system. We can do it ourselves with improved Medicare for all. Everybody in, nobody out.